welcome to the Medical Pulse podcast, where we explore the journey of becoming a doctor. I'm Anish Mohan, and in each episode, we dive into the challenges, rewards, and realities of medicine through conversations with doctors in a variety of fields. Whether you're aspiring to join the medical field or just curious about healthcare, this podcast is for you. Let's get started. Hello, and welcome to the first episode of the Medical Pulse podcast. I'm your host, Anish Mohan, and I'm here today with Dr. Arun Suryaprasad. Doctor, thank you so much for taking the time to join today's show, and I'm really excited to get started.
You, Nish, for having me this afternoon.
Yeah, no worries. So, to start us off, I just want to get to know you a little bit more. So, please tell us a little bit about yourself. What you do, what's your role in the medical field, and obviously, like why you enjoy what you do.
Absolutely. So I'm first and foremost, a frontline gastroenterologist. I've practiced in GI for about 21 years now. And before that, I did 10 years of training. So beyond college, about 31 years. I mainly work seeing patients in a clinical setting. I also have a specific interest in therapeutic endoscopy, so advanced GI procedures like ERCP and so forth. Some of the more advanced things in our field procedurally is what I specialize in. I also have a second career, which is working in care experience. Physician director of care experience for our section of Kaiser Permanente. I work for a large multi-specialty organization in Northern California called Kaiser Permanente, which is a value-based healthcare system driven on leveraging integration and focusing on outcomes. And in our medical group, I am, for our section, the physician director for care experience and helping our members get a better care experience and enhancing their care experience every day. So that's a little bit about me. And, we can, I guess, dive into a little bit about the pros and cons because I'm sure everybody wants to hear
Absolutely.
about
Yeah.
that a little bit later in our conversation. But that's my background.
Okay.
Uh,
Okay. Wow. That was a lot. Thank you so much. Okay. So you definitely have a lot of experience on your belt, obviously 31 years. You've had a lot of time to really understand a lot about the medical field, but I wanted to ask a couple more questions about you. So, in your opinion, what do you think sparked your initial interest in the field of medicine?
Great. Well, that's a great question. I think, I'll be quite honest and transparent. I don't think I was as intentional when I was entering the field of medicine. I think in my generation, some of us were not as well thought out in
Okay.
our decision making as, your generation is. So quite honestly, both of my parents were physicians, but I still did not have a really good feel for what a medical career actually entailed. I think it's more I knew that I wasn't interested in something overly technical. And when I was in my educational years, computers and computer science really was in its infancy and was not a very popular career choice, unlike today. So most people were either going into business or technical fields. And I felt like I wanted to do something where I could directly impact patients' lives and people's lives, rather, and do that along with some critical thinking and investigational thinking. And I knew I enjoyed working with my hands. So the combination sort of led me to medicine. That was the concept that drew me there, but I, honestly, in full transparency, didn't know what all it would entail. But that's kind of how we in our generation kind of picked our career paths,
Yeah,
did some
absolutely.
volunteer work in college and had some exposure to medical research in college. And I enjoyed those experiences. So I think the combination of experiences just made me jump in.
Absolutely. And I think, especially in today's day and age, a lot of people think that medicine is something that needs to be planned out a lot of time in advance. Like if you want to do medicine, that is something you need to decide extremely early on. So what are your thoughts on that? Do you think that's uh correct?
So that's a great question. I think it's a very difficult question to answer, and here's why. Um, Part of the challenge of medicine is I don't think one really has a good feel or can get a full feel of what a medical career entails until you look backward.
Yeah.
And it's really tough to know ahead of time. And I'll explain why, because, you know, medicine is unlike most careers in the sense that you don't work an 8 to 5 job.
Yeah.
You
Yeah.
have, generally most doctors work about 10 to 12 hours a day. So it's, beyond your work every day, people round the hospital, do, messages, try to meet patients' needs. We call it pajama time
Mhm.
in medicine. And so there's a lot of work after work. I expect with AI and technology that some of that will be better, but there is a large, it's a marathon. It's not a race. And so while you kind of go through college and then medical school is more intense and the residency and fellowship are even more intense, and truly that is the peak number of work hours you'll probably
Mhm.
work, because you never will work quite as hard as residency and fellowship. But at the same time, your career path is 25 to 30 years, and the intensity never really slows down unless you choose to draw back from your career and go
Yeah.
part-time. The intensity is unlike most other fields. And so there's a lot of burnout. And I don't think a lot of students understand that about 50% of physicians are burnt out. We
Mm.
call it moral injury, and it is a real crisis. And I think that there is a great expectation that technology and improving technology will help, but that still remains to be seen. And I think understanding that you are making a commitment that is going to be fairly grueling, but doing it with a passion to help people and enjoying what you're doing is really the best you can do in your decision making, to understand it's going to be a grind. It's going to be a long haul. It's a lot of hard work, and it doesn't stop with
Yeah.
training. That's just the beginning. Most
Yeah.
people think, oh, I've done the hardest part. That's not true. It's a long career and it is tough. But if you're prepared for that mentally and enjoy the actual thing that you're doing every day, you have to have passion for it.
Yeah.
And so if you have a passion for it and you're really focused on helping people and focused on actually enjoying what you're doing every day, I think that's what gets you through the career and makes it fulfilling. But you're saying in the numbers that I think only 50% of people who entered the career actually knew what they were in for.
Okay. Yeah.
And so the best you can maybe do as a student is to, really talk to a lot of practicing physicians. Don't make a premature decision. Take some experiences in the medical world, and not, you get only a very brief glimpse by volunteering and even working in hospitals. It's because it's exciting to see the content, but you really have to talk to the people and what it's been like and
Yeah.
understand and really take that knowledge in and know, is this for me or not? And am I mentally prepared? And it's really hard to do. It's just so hard to do because, even when you feel mentally prepared, really I'm in the last third of my career. When you're there, you really had a sense of what it's like.
Yeah.
And you can't really say that unless you get to that point. And
Yeah.
that's the tough part of a medical career.
We'll talk about later in the podcast kind of what students should be doing in high school um, to hopefully get the most experience, the most experience, and kind of understand, is this truly what I want to do? Like you said, you need to have that passion to be able to completely pursue medical field. And you said 50% of people don't even understand truly what they are going in for. So I think that's going to be really as long as they completely understand it is a time commitment, you need the passion to be able to do it. That really knocks out a lot of people from going into the medical field, I think.
Absolutely.
Yeah. So You talked about a lot about how the technology has changed, and you're saying with the technology that is being changed in the medical field, things have been getting easier or things have been changing. So, in for you, for your experience, how has the medical field evolved since you started?
So let's take that from, I'll answer the easy question first. And the
Yeah,
easy question is that there are a lot more from practical, from a procedural application point of view. There's always evolving technology to improve outcomes and patient care.
yeah,
I'll give you an example. When we do this thing called ERCP, what it is it's a procedure to deal with bile duct obstruction, whether it's from cancer or whether it's from stones that have gone into the bile duct. And traditionally, we use X-ray, fluoroscopy X-ray to actually visualize inside the bile duct because there wasn't a camera that actually went into the bile duct where you could directly visualize what you're doing. And now there's something called spyglass, where we actually do procedure, a scope within the regular duodenoscope to actually do work within the bile duct. So medical technology is ever evolving. In the surgical realm, you're seeing a lot more surgery going into robotics, and robotics is improving outcomes. And so more and more surgeries are being done robotically, and I think more and more will be done that way down the line. So it's exciting to see that patient care and the application of procedural technology to patient care is ever evolving. I
mm,
think the tougher aspect of it is really you where technology and medicine come together.
yeah,
I've heard from, your dad included, many people in the technology world. Healthcare is particularly bad in
yeah,
terms of technology. And I don't think most people realize that, the Epic, which is the main healthcare EHR system for about 70-80% of the country, I think. It's built on an old coding platform, and the
mm,
main driver behind EHR systems is based on coding, not user friendliness. And so current technological platforms we have are very user unfriendly. So it is cumbersome to do charting and doing messaging. And a lot of the onus falls on physicians and healthcare providers to fill those gaps in those technological gaps that exist, because the healthcare platforms are really designed around billing.
yeah,
AI is being built into some of that. We're still in the early stages. And I think that maybe over the it'll take time. We're really the AI that is not super helpful. It's somewhat helpful. It's not super helpful to us
mm,
now. But I think in 5 to 10 years, people entering medicine may have a fully different perspective where, the idea of being a doctor is focusing on the patient. Not all the other
yes, yeah,
stuff is the minutia, the documentation and the technical things. And we can sometimes get lost in thinking that technology and stuff is more important, and medicine's not. And I think a lot of doctors lose sight of that. And I think what's important is actually the patient care. And so the technology should be designed to help us with patient care and help us actually focus on the patient more. And I think it's going that direction. So I think I'm optimistic that it'll be much better for future generations. We were kind of the gap generation where you were paper charting when I started,
yeah.
and now we're on EHR, and the EHR systems pretty much suck. So you're in this kind of gap where it's going to get better, but we're not there yet.
Yeah, and
So,
the response that you gave actually really did kind of push into the next question I was planning on asking was you kind of did answer it, but I wanted to ask you more of like a prediction for the future. What role, I mean, we talked about robotics touching into surgeons, and that's always something we see. Like we see in the medical shows, the medical movies of the robots in the OR. But what role do you specifically think artificial intelligence or AI will be playing into modern healthcare going into the future?
good question. I think a lot of people have variable opinions on this. Um, my personal opinion, and it remains to be seen,
Mhm.
is the AI, and I've seen some beginning glimpses of this. knowledge-wise can sometimes outthink doctors. And really knowledge-wise, I think it will get to the point where it's so nuanced that we don't need brainy doctors who can memorize all the facts, and even those who are applicable are good at applying those facts and critical thinking. That's a good feature beyond just memorization, but it's not the primary thing because AI will be able to do a lot of those things equally good, if not better, than most humans. And so, but in the end of the day, even when I talk to people in technology, nobody wants a machine taking care of them, particularly when you're sick. And there is a human element to medicine that cannot be
Absolutely.
reproduced by
Yeah.
machines. And I think everybody wants human connection. And that's where I think the focus of who will actually be the better doctors in the future will be those who have compassion, who have a human touch, and who have a mission oriented I focus. And I think what we should be doing as medical educators, I do some of that as well, is focusing on finding those people who are not brainy or have all the test taking skills, or even who have great critical thinking, but people who have a sense of mission and a sense of compassion, because I think technology will fill in all the rest of the gaps. And so the focus of who will actually be the doctors we need will be completely shifted
Mhm.
from what we have now. And I think that's a good thing, not a bad thing, because I think there is the human element of medicine that, quite frankly, sometimes is missing today, and
Yeah.
sometimes we've lost sight of. And I think that this will bring it back into focus.
So we talk about kind of like the character traits of what you think obviously potential doctor or future doctors will have. We can see how kind of like you say that like you obviously need compassion, and that's kind of you're saying kind of being swept under the rug when most people start thinking about the test takers or the nerdy doctors. Like that's so certainly a big part, but also understanding you need to have compassion for your patients. You obviously need like there's a social component to being a doctor, and that is a big part that I think not a lot of people understand.
Yeah, I think it's really the biggest part of niche because I think um, with the rigors of the job, there's tends to be a lot of compassion fatigue. And I think it is, I mean, with the hours you have to put in, the fact that you're not necessarily the you're well compensated, but you're not the highest compensated, and you see people making much easier money. What at the end of the day, we spend most of our time doing our work, even more so than with our family. And so if we cannot look back at our lives and our story and know that we did it for a reason and that we had fulfillment for what we did all those years, then it's really not worth it. And so it's that a human element that most people reflect on, whether it's working with colleagues and the things they did to improve patient care, or the patients whose lives they touched, and more than all the other stuff. And so that's what really should be the driver of people entering medicine, I think.
Mhm. Okay. Okay. So as we talk about students kind of going into medicine, especially future students, which I wanted to talk about now, we will get to kind of the essential skills and qualities. But first, I mean, I know as a student, and I know a lot of other students really think this is important. What do you think are the most academic steps future medical students should be taking on a pathway to medical school, especially in high school? What are the most important academic steps, do you believe?
Yeah. I'll be fully transparent. I'm not sure it's that high school really plays into getting into medical school. They really
Okay.
are focused on what you do in college. That said, there are certain things that can build your motivation and maybe your foundation. And I think more so than just being exposed to medicine is actually doing things that are service oriented in high school
Okay.
and seeing whether that sense of service really motivates you. I don't, there's many different ways to do that, whether it's volunteerism, whether it's leading things that actually help people. And there are many creative ways to doing that. Medical research, definitely, if you want a research path, getting an exposure to that in medicine. All of these things can be good foundational activities. But it's far more important when you get into college to do certain things. I do think that medical schools want to see some exposure to research because they want to know, does somebody who's entering medicine, do they know what a research path is like? Not that it's the most important thing, but they want some exposure just because it is a good career path and it's a good career path of helping people. But if you don't have any exposure, then when you're entering medical school, you're a little bit late to the game.
Yeah.
Equally important, however, is the same carrying out that sense of service and showing that sense of helping community as with service, however you do it within college, in addition to your academic activities in college. I think that stage is really the most important thing.
Okay.
Um, I think that, and there are many different ways to do it. And of course, you do have to do well in school. Just share with you. So my medical school, um, University of Cincinnati, we looked it up, has an acceptance rate of about 2.93%.
Okay.
So about 2 to 3% of students who apply get into that school. So it's more rigorous to get into medical school than in many cases Ivy League
Yeah.
colleges. That said, I'm not sure that medical schools are necessarily looking for the brainiacs, as we've alluded to. And I think a lot of people are missing the boat on that. And they are looking for people with good grades, but a lot of people have good grades, but they're
Yeah.
looking for the other stuff. And I think they'll be increasingly looking for the other stuff we're talking about.
And that actually perfectly goes on to the next question I was thinking about asking you is what do these medical schools want to see, whether it's like essential qualities or skills that people should focus on? Like you said, obviously there's not that many things that you can do in high school, but you can obviously focus on the skills and qualities. So in your opinion, what are the most important ones?
As we've alluded to, I think an exposure to research, which could be a summer research job for 1 or 2 summers. I think they like to see that mainly because research is a career path in medicine that is different in some cases to clinical, and both make impact. Both can offer service, but I think that they're both divergent clinical paths. And when you're in medical school, they want you to actually produce. So in college, they want you to have an exposure to research. So doing the research in your college time frame is kind of important. It's important, not kind of important. But you don't have to write some major paper or anything, but just having an exposure is important. And I do think that, obviously it's competitive and you have to figure out who you're going to take. So grades are important, but they're not the only thing. They're not the be all end all because quite frankly, everybody who's applying to a lot of people who are applying to med school have good grades, right? But I think they are also looking for people and they will be increasingly so as technology fills in knowledge gaps to actually show that sense of, compassion, that commitment to service, that dedication to service, and finding ways to doing that and making sure it's more than just getting a medical school, making sure that that is really for you because that is what is going to, as we've talked about, going to sustain your career, which can be quite grueling. I mean, I've seen so many doctors who are from top level medical institutions just quit, and because they just realized somewhere to their medical career, it wasn't for them.
Mhm.
And that's okay. I mean, it's probably not good to do something during your life that's not for you. And so I think it's to make sure that you have that commitment to service is something that they want to know because they want to know if they train you, will you serve the community in one way, shape, or form as a physician through an entire career.
Mhm.
And so I think that's what they're looking for. And there are many different ways to doing that. And I understand that there's probably many people who are going to personify all these features. And it's unfortunate to me that they have so few spots for medical school. And I think that's a travesty, not only in our country, but even in our native country of India. It's the same thing that's playing
Yeah.
out. When you have major doctor shortages, why the heck are you restricting medical education to
Yeah.
so many? And slowly, we're starting to build new medical schools. North State here in California and Sacramento area is the newest medical school. Kaiser Permanente has a new medical school. And those are two of the newer medical schools. So there are some increase, but not nearly enough to the needs of doctors. And it's an unfortunate thing. But
Yeah.
the best you can do is to sort of make sure it's for you that way and get all the features necessary and hope for the best.
Yeah. And yeah, you said like you make sure you have the experience, make sure you do everything you possibly can to show colleges that you are ready for your medical career. So finally, last question I wanted to ask you with the pros and cons of what you do, your job as a doctor, as well as what students are doing to try to get into medical school. What final words of wisdom do you have for high school students looking to get into medicine?
Yeah. As I said, I think college is really where it's most
Okay.
important. I think as a high school student, do your best in school, um, get good grades, and most people who will be looking to career in medicine will be doing that.
Mm,
But focus on finding service-related activities to make sure that a commitment to service and helping people is motivational enough. It's more than just doing it. It's making sure that it's really enhances your sense of personal wellness. Because while you're helping people, it is also about helping yourself and that motivates you internally. And if you find that that's the case, that you get invigorated by helping people, by actually doing service, and then and you also have good grades, those will be the features you would need to then dovetail into your college career to
yeah.
do all the things that we talked about.
Okay. Okay. Yeah. So, okay. Thank you. So, just understanding for it's not, I mean, obviously high school is important, but it's mainly what you do in college that will determine your success, not success, but how you progress in medicine, especially in medical school residency and further on, correct?
Percent. And I think that people overestimate names of colleges. I think how you do in college and what you do in college can have as much of an impact, if not a greater impact, than any brand name school.
Okay.
I think medical schools are actually looking for that, is they're not looking at, necessarily the people who always come for the brand name schools. I mean, certainly some of those people, when they come from a really good school, they're going to have some kind of leverage, but it's not nearly as much as doing well in college in your grades, but also doing all the other things. Somebody who has all of the personifications we've talked about, and in addition to the grades, would be a far better candidate for medicine than somebody coming from an Ivy League school who doesn't embody all of those features.
Yeah. Okay. Well, thank you. That's it for me. We kind of went over the three main things I wanted to, which is about you, your area of expertise, what you do, the advancement of medicine, or kind of how the medical field has progressed from the past to even how it's going to look like in the future, and then obviously what students in high school and college should be doing to hopefully gain valuable experience and understand what the work will be like in medical school. So thank you. Dr. S, thank you so much for taking the time out of your day to come on to the Medical Pulse podcast. The hope is that this information will help many people with their understanding in the medical field. And thank you so much for joining me.
You for having me, and it's
Yeah.
been a great opportunity. Thank you. Have
Thank
a great
you.
afternoon.
Thank you. You too.
Bye bye.
That's a wrap for this episode of Medical Pulse. Thank you for tuning in. I appreciate your time and support. If you enjoyed this episode, don't forget to subscribe and share. Stay curious, stay inspired, and I'll catch you next time on the Medical Pulse podcast. Thank you for listening.